Link TV, connecting you to the world. Link TV is viewer supported. Watch more at linktv.org.
How dare you!
I want to know if it's coming out of my paycheck.
The strongest fury directed at fears of a government-run system.
The U.S. is the only major industrialized nation that lacks a comprehensive national healthcare plan.
Healthcare in the eyes of the world, next on Global Pulse. How these media are covering the healthcare debate. Hi, I'm John Hamilton, filling in for Aaron Coker. As the healthcare debate rages across the United States, we at Global Pulse sought out healthcare stories from other nations. And like the U.S., there's another large country with a dysfunctional healthcare system and a government bent on reform, China. According to CCTV, Beijing plans to spend $124 billion over the next 3 years. And in this communist country, no one is arguing about it.
By 2020, the world's most populous country will have a basic healthcare system that can provide safe, effective, convenient, and affordable health services to urban and rural residents.
We'll see how that turns out. Meanwhile, here in the U.S., the revolution will be televised, but in a whole new way. First, a town hall protester posts a video to YouTube.
It's not your right to decide whether or not I keep my current plan or not.
Then Fox News broadcasts the clip across the land.
It's not your right to decide whether or not I keep my current plan or not.
Turning the protester into a TV news star.
And joining me now is the man at the center of that showdown, former Marine Corporal David Hendrick is with us.
Opponents of the proposed reforms often point to the British National Healthcare Service, the NHS, as an example of failed national healthcare. That was more than the BBC could take.
When foreigners take aim at your national health service, well, national pride is bruised.
In Britain,
Anger from British people inadvertently caught up in the barrage of political adverts.
Kate Spall. Her mother suffered on a wait list as her renal
Including
cancer
Kate Spall, who campaigns to improve the NHS and says she was duped into appearing.
I couldn't believe that the work I do is being allied with those views.
But those views are gaining ground, according to an ABC News poll.
The weakest link for the president? Seniors. Just 34% of seniors in our poll support the proposed reforms.
I'm afraid that when we got into it, they would control who you see and what specialists you went to.
South Koreans are also upset about healthcare, but for the opposite reason. Their president wants to privatize it. South Korea's mandatory national insurance plan proved too popular to mess with, as KBS explained.
The South Korean government has been considering loosening the national health insurance system to open a door for private health industry. But the public is strongly opposed to the idea. Today, the government canceled its plan.
CNN's Lou Dobbs compared the U.S. healthcare system with others around the world, including this profile of Sweden.
In Sweden, people go to a publicly run healthcare center for all medical needs. Doctors work on straight salary for the clinic. Out-of-pocket expenses are low. But people pay 14% income tax to the counties on top of national income taxes.
According to statistics from the Organization for Economic Cooperation and Development, these developed countries have similar, though slightly higher, life expectancies than the U.S. And except for Japan, more doctors per person. Their per capita healthcare costs, however, are nearly half of U.S. costs. As this CBS News story illustrated, the high cost of U.S. healthcare impacts those on the lower end of the income scale.
These are just some of the tens of millions of Americans who need health care but have no insurance or not enough of it. So they're lining up at a free makeshift clinic in Los Angeles.
This is my husband. Anna Garcia got in line Tuesday. She works for Orange County. The copay for 3-year-old Aiza's root canal, $1,000.
I couldn't afford it, and I didn't want her to lose her teeth.
The clinic was run by a group founded to bring medical care to third world countries. But now most of its work is done in the U.S. because the need here is so great.
Well, no matter where you live, everyone has a healthcare story to tell. And we want you to webcam your healthcare story to us at our new video chat site. It's online at linktv.org/realconversations, and we'll air some of your comments. For Global Pulse, I'm John Hamilton.
Link TV is the only U.S. network dedicated to global and national news, uncompromising documentaries, and diverse cultural programs. Programs which connect you to the world. To learn more, visit linktv.org.